Hello everyone, today we are going to talk about ectopic pregnancy. Ectopic pregnancy occurs when an embryo attaches outside the uterus. So it's most commonly in the fallopian tubes. It is frequently associated with PID, which is pelvic inflammatory disease, and it may lead to stenosis of fallopian tubes. This prevents the fertilized egg from passing through to the uterus, instead causing it to attach to the tube itself. Now, what is PID, pelvic inflammatory disease? A bacterial infection that spreads beyond the cervix to any part of the upper female reproductive tract. Pelvic inflammatory disease can affect uterus, ovaries, fallopian tube and surrounding tissues. When it affects uterus, it's called endometritis, and when it affects fallopian tube, it's called salpingitis or tubo-ovarian abscess, and when it affects ovaries, it's called oophoritis or tubo-ovarian abscess, and when it affects surrounding tissues, it's called parametritis or pelvic peritonitis. Now, what are the signs and symptoms of ectopic pregnancy? First of all, the signs of pregnancy. Symptoms include abdominal pain and vaginal bleeding. How we diagnose ectopic pregnancy? The first step is to confirm the pregnancy with beta-HCG test, and we should be followed by a transvaginal ultrasonography to determine the location of pregnancy and the fetal heartbeat. Uncomplicated ectopic pregnancies often resolve spontaneously and usually difficult to diagnose. Patients are typically hemodynamically stable with low and declining HCG concentration less than 5,000. The complicated case may involve tubal abortion or rupture, which can lead to intra-abdominal bleeding and shock. Now, how we treat it? Uncomplicated cases are treated conservatively with methotrexate and expectant management. Complicated ectopic pregnancy requires surgical removal. Now, in the case of abdominal pain in women of reproductive age, it is important to rule out ruptured ectopic pregnancy. So, thank you so much. If you like my video, do subscribe.